Here at Children's, we specialize in taking care of kids that have a lot of time to grow. So we have to take those unique aspects into consideration.
Jared was riding his bike, going around a little bit of a turn, and he must have gotten twisted in his bike because he fell and his bike fell with him. You heard the loudest scream and cry that I had ever heard in my life.
I met Jared when he was 5 years old. He was transferred to Children's Hospital with a broken femur. And in the orthopedic world, there's a lot of research into these femur fractures and what sort of treatment does best for different age groups of kids. And so he got 2 titanium nails that went into his femur that fixed the femur. And that's a real sort of cutting edge way to treat that these days.
Dr. Atchin did prepare us that Jared's pain would still be severe and he would in fact need surgery, and the recovery was going to be tough. He was calm and professional. We all, including Jared, felt very confident that he was going to be in good care.
In addition to treating the broken bone, which sometimes can be the easier part of the injury to treat, the most important thing is to reassure them that given some time, that they're going to get back to their full activity and this is just a bump in the road. That is a sort of what we call this patient, family-centered approach.
What Dr. Atchin did for me, I will never forget, because he was very responsive, and having Dr. Atchin behind me made me know Jared was going to be okay, I was going to be okay, and I could push Jared to challenge himself, and that was okay too.
I think that one of the things that we do well here at Children's is we try to bring together the standard of care, what people are doing and what we know that's going to make people heal well. And we try to also contribute and bring in some of the sort of leading cutting edge research that's out there as well. And then combining that scientific approach with the best care for the patients. One of the benefits of orthopedics is that with these injuries, oftentimes they do well if you can treat them correctly, and they can get back to their sort of normal function. And you see a child who's just 6 months, a year later, back to himself, and it just makes you feel great.